the VCA Voice podcast. I'm your host, Dr. Marie Kerl. Our goal with the VCA Voice is to showcase how VCA Animal Hospitals is taking care of the future of veterinary medicine. We'll bring our purpose to life through meaningful conversations about care, our culture, and the communities we serve. On today's episode, we're chatting with Dr. Phil Bergman and Talon McKee about the VCA Clinical Studies Program. Listen in. Phil and Talon, welcome.
Thanks so much for having us.
Yeah, thank you.
So I think what I'd like to do is to start off with just hearing a little bit from both of you, really about your progression through veterinary medicine. And Phil, why don't we start with you? Tell me a little bit about your veterinary journey, but also your VCA journey as well.
Yeah, so my journey in veterinary medicine started, I was one of those kids that, as long as I can remember, always wanted to be a veterinarian. Started working at a small animal practice close to where I grew up. Started as a kennel attendant and then moved my way up to being a veterinary technician. Was lucky enough to then get into veterinary school. And when I would come home at times, I would go back to that practice to work as a technician. After veterinary school at Colorado State, I then did an internship at Kansas State. Then was lucky enough to come back to Colorado State to do a medical oncology residency. And it was there that I got bit by the research bug and really wanted more. So decided to pursue a PhD in cancer biology and decided to go to MD Anderson. They really rolled out the red carpet and understood that I was different than a typical graduate student. So after my PhD was done, I then moved to become the chief medical officer for Bright Heart Veterinary Centers. Bright Heart was then bought by VCA in 2011. And that's really when my full VCA journey started. So at that point, I was the medical director for Katona Bedford.
Oh, wow.
And again, previously the chief medical officer for Bright Heart. And they didn't really exactly know what to do with me at that point. That said, they knew that my heart was in clinical studies. And Dr. Tams, who was at the time the chief medical officer for VCA, and we put our heads together and came up with starting a new division at VCA, being clinical studies, because that had not existed previously. And so they were then able to help me with having Tracy Mills start, who still remains with me today and is one of my right-hand people when it comes to doing our clinical studies. And we've grown since then. Talon McKee is now a clinical studies coordinator. We recently hired Linda Louie to help with financial accounting. And then the latest example of that growth, we've recently hired Negan Habibi. And what she's going to help us out with is protocol development and all the other things that CROs do. So it's been really nice to see the foundation that VCA built with this. And now that VCA journey is continuing to expand because of our association with Mars. We're one of the principal groups that helps Waltham and Royal Canin and all these other Mars business units do their clinical research. So it's been an unbelievable journey and really has been a ton of fun.
Now, Talon, I'm gonna turn the microphone over to you, and I'm gonna ask you the same question. Tell me about your journey through veterinary medicine and with VCA, and how you made the shift to be involved in clinical studies.
Thanks, Dr. Kerl. It's been a different experience than what Dr. Bergman has had in his background, but we did start off in a similar setting. My career also started as a kennel attendant, which I started right in high school. I knew that I wanted to be in veterinary medicine from an early age, and I wanted to get my foot in the door as early as I could. So that was definitely the route for me. And I kept with that route and built my way up, doing more of the on-the-job experience while I was trying to get into vet school. During that experience, though, I did learn that while I was doing my undergrad, that wasn't an option for me. But instead, I had a good career that I was building as a veterinary technician and continued to pursue that route. So I've worked in a variety of different practice settings. My start was more in rural primary care out in Utah. And then I made my way into higher end primary care settings, like larger hospitals. And then I made a decision to move to Los Angeles back in 2014. And during that time, I only applied to maybe 2 hospitals at the time. And one of them was VCA West Los Angeles Animal Hospital. Prior to that, in Utah, we didn't actually have very much specialty medicine that was practicing there. So coming into LA and doing an interview with West LA particularly was pretty intimidating. But somehow I managed to at least give somebody some type of impression that I knew what I was doing, and they allowed me to come on board for VCA West. We had a really high-end anesthetic service at West LA. The technicians were extremely involved in all aspects of care. There became a tipping point, though, where I was interested in expanding my skill set beyond clinical care. And that's when an opportunity became available with VCA clinical studies. So now I find myself as a researcher, someone that's interested in doing research and conducting my own research. And I think that's just an interesting opportunity to see from a technician perspective, because we don't always see that in the field. And so I've been really happy and blessed that I had this opportunity to grow with VCA.
I love that both of your stories really highlight the evolution of both of your careers and progression through veterinary medicine. And I think that so many of our associates actually experience that same growth and evolution. And it's incredibly important to do that through a career and kind of think about how do you position yourself. I'd like to dive in a little bit more to the clinical studies program. Walk me through how clinical studies work from the inception of a project. Let's just, for example's sake, use an outside project right now. And then what happens at the level of the hospital? Who is important in the hospital level? Is it a whole team project? Is it just one or two people? So Phil, why don't you start with that and walk me through that a little bit, and you can both provide input to that question.
Yeah, I'd be happy to. So, if we get approached by a Zoetis or a Boehringer or a Lang, all those different groups, we first will have discussions with that sponsor to ensure that we feel confident that we're able to do the scope of work that they're asking us to do. The big advantage we have within the VCA framework is that to date, I've not seen a scope of work that they've thrown at us that we've not been able to handle. And I think that speaks to our amazing breadth of, again, technicians, house officers, clinicians, and the different types of hospitals that we have within the VCA family. Mm-hmm. And once we've then made that decision that I think we can do that scope of work, oftentimes those sponsors come to us with a fully fledged out protocol. So, they have the best ideas as to what are their goals and interests. They often have done a lot of work leading up to this to know whether this is something that they really want to do and therefore fund. And these may be studies that are very simple, or they may all the way go up to what we call pivotal studies for licensure, either at an FDA or a USDA level. And then we've also done some what we call phase 4 studies. When we then figure out that we can do this, we come to terms on a budget, we get through all of the legal agreements that we have to do. That's when we tend to start reaching for our hospital colleagues. And maybe I'll turn it over to Talon to kind of talk about how we cultivate those different hospitals.
It's an interesting process that we do with engaging our hospitals in clinical research. A lot of the times we have very specific opportunities that come, especially when it's an external process that may be specialty oriented. And we have a great network of specialty hospitals to work with. In terms of who we leverage the most when it comes to the hospital teams, the hospital leadership is an important aspect of that, making sure that we have buy-in from them, that they have an interest in helping with this study. So we need to have buy-in from the clinicians, and we need to have buy-in from the technicians as well in order to be successful. I think it varies from there how much or how little each is involved in executing a research study. I think it's a team effort. Not necessarily everybody in a hospital team has to be involved, but you do need to have a few key individuals that are really motivated and interested. I've always seen an intrigued interest from technicians, and they really make it successful for us. Because they do take a lot of the work on in terms of documentation and finding cases and talking to it through with the owners. And that tends to make it really successful.
With as busy as our hospital teams are, even in identifying a specialty or a primary care hospital that sees that set of cases that would go into this study, is it all that intrinsic motivation that they want to contribute to science, or why would a hospital take these on when they're already so busy doing other things?
Yeah, I think you've hit the nail on the head. If I've learned anything over the last 30 plus years of doing this, is that you never want to assign a hospital to do a study because it's the surest, quickest way to kill a study. We need to have a group of folks at that hospital that are willing to step up to the plate, that care about the future of veterinary medicine, and they realize that without these studies, we can't get new diagnostics, we can't get new therapeutics. And the only way that we get better in the way that we practice is by having those new aspects for our clinical practice. And so, one, we try to make it as less obtrusive to that clinical group as possible. You know, our North Star with clinical studies and in asking our associates to step up and do these studies is to have it be as minimally impactful to their practice experience. The other thing that is a North Star for us is that we want to make sure that they're taken care of financially, no different than if it was a client that was paying the bill. So in this situation, it's a sponsor that's paying that bill. And then we also ask the sponsor to make sure that we're taken care of financially when it comes to the extra amount of work, when it comes to extra lab samples, paperwork, and things like that. But in the end, you're right that it takes a committed team to do this. And I would also offer that those sites that Talon and I always talk about, we want to clone them because they're just amazing at what they do. You know, they recognize in a lot of ways that, one, they're contributing back to veterinary medicine. Secondarily, they actually leverage these studies in their local area. We know that competition is fierce sometimes in veterinary medicine. And so those folks, I tend to find that they get that word out, that in fact they are contributing to veterinary medicine, and they use that to then say, hey, I'm working on state-of-the-art types of things, and that makes me different than the rest of the potential doctors that are out there. And then lastly, I tend to find that those people are some of the happiest people in their profession. It kind of comes full circle for them. And Talon, do you have additional thoughts there as to what that looks like at the hospital level?
Yeah, I think I would just reiterate some of the points that you've mentioned. Having the opportunity to be part of clinical research, I think, is an opportunity for your clientele as well. And I think a lot of our sites recognize that you're being able to offer services that they're not going to be able to find elsewhere, especially with, maybe cutting edge medicine is what we may see in some of our research opportunities. There's the other aspect too, where it's a little bit more altruistic in the motives too. Wanting to be able to contribute to veterinary medicine and progression, and being able to, offer treatment there as well. But I think, overall, Phil's kind of hit it on the head there, where, those are the aspects that make something successful in our field, and having our field want to be part of these clinical research opportunities.
Those are great points. And I look at, if you're in clinical practice, you help that patient and that client at that time that you're seeing them. Being involved in research, I think, gives you the opportunity to touch many patients and many clients with success in the future. Another question I have, we study naturally occurring disease. We don't create disease. This is all using the naturally occurring disease that happens in the patients that we see to help future patients, help clients, help veterinary medicine. Tell me just briefly, in human healthcare, how people find clinical studies. If I had a particular illness and there was a research study going on, how do our clients get the information of what clinical studies are out there?
Yeah, if you look in the context of the human side, and as an oncologist, I'll speak to how that works on the human oncology side. It either could come from your healthcare provider, meaning that maybe there's not a great standard of care, and so therefore they then push you to think about investigational options. Or alternatively, most of the time, folks will then go to an NCI website on cancer.gov, and that allows them to then plug in all of their information, whether it's them themselves or potentially a loved one. And oftentimes that speaks to age, gender, what's the cancer diagnosis, what is the stage. And oftentimes it includes a zip code. So you can then find those studies that are within your general sort of local regional area. And that's been a remarkable tool to then have folks look for those different types of trials. Mm-hmm. It then includes a lot of information related to, who's sort of the principal investigator of the trial, who's the primary contact in case you want to reach out before potentially setting up a consultation. So it's an amazing website that was sort of the North Star that we had when we put together a similar trial registry for the AVMA. And I'm proud to say that I was the VCA representative for that working group at the AVMA. And we basically took something that the Veterinary Cancer Society had as a trial registry and essentially opened it up to make it very similar to the NCI trial registry, but it was not specific to oncology. It was really for any type of trial.
Wow.
It's also started as small animal, and it's now opened up to equine and potentially other species as well.
Sounds like we have a strong and evolving mechanism for clients to be able to reach out and understand what's out there for their pets and how we can learn and grow in the future.
Yeah, the trial registry, to be frank, the good and bad of that is it's great that it's a central repository for the studies that are put on that registry, but not 100% of studies are put on that registry. And that sort of speaks to some of the sponsors that are out there, because some of them may not want to sort of show all their cards, so to speak, by putting those studies available publicly. Mm-hmm. But I would venture to guess it probably covers 70, 80% of studies.
Yeah. We're approaching the 3,000 mark of interns that we've trained all together within VCA. We're a little over 2,900 now. And that's a very exciting number to me, because that training and mentorship, that and our residency programs and specialty internship programs are a phenomenal part of VCA. How do you take someone who is brand new in their career and has a strong interest in learning those principles? What does that study creation and first study look like that they're doing? And how does clinical studies support our house officers?
I think every intern or house officer that comes to Phil and I to help with their research opportunities is a great opportunity to, one, train a future researcher in our field, and also give them an opportunity to, find passion within research as well. And so I think that's something that we'd like to foster, because these, interns and residents are going to be going out there and making our new specialists, our new primary care doctors. And we want to foster that growth of importance and recognition of research so that they'll want to continue to participate in that. So I think, an aspect that Phil and I really like to put into our work with our house officers is a hand-holding kind of aspect to it. We want to be partners with them throughout the entire process. Mm-hmm. And it's really to make sure that they're well supported in every step of the development of their research, because it is an intimidating process to go through. There's not always a lot of background that these house officers get in their training. And then to go out in the field and have an expectation to try and do that can be a really hard lift. So we want to be there to, help them overcome those obstacles, use our experience there to be able to guide them along to make a successful and feasible research project.
Yeah, it's one of the things that for me is very fulfilling. And in fact, multiple, RMDs within VCA, especially those that have considerable university background experience, they feel that the amount of hand-holding that we do actually approximates, if not surpasses, some of the experiences that they've had in academia previously. So that really makes us feel good, but probably even more importantly, that becomes an engaged researcher for life.
What's the biggest novice mistake for somebody creating their first study? And I laughed when I asked this, because I've made all the novice mistakes.
Yeah, me too. Yeah, the most common mistake is they want to answer multiple questions. So Talon and I spend a lot of time saying, okay, let's come back to reality. We have X amount of time to get this work done. And oftentimes, if you ask too many questions, you'll never get a single one answered. So ask one question and do it well. And I tend to find that those, I call them kids, but they're trainees, they then start to learn and appreciate that because they know there's a lot of experience behind that.
Yeah, I think it's something similar along those lines as well. It's just, shooting for the stars a bit and having to come back to reality a little bit when it comes to that. And it can be hard to understand that when you're trying to put something together. You want to put together the most, rigorous study that you're trying to do there. And sometimes that is a bit more lofty than what can be actually executed.
We only have a few minutes left. I want to make sure that we have time to talk about the Mars Veterinary Health Biobank study a little bit. So, Phil, can you share what that is and why we're doing it, what the plan is, what we're hoping to learn?
Yeah, so the Mars Pet Care Biobank is a truly revolutionary study. This started getting socialized back in November, December of 2020. And the idea behind it was that we would be doing a study that was a very large longitudinal study in both dogs and cats that would accrue 1,000 cats and 1,000 dogs per year for the next 10 years. So a total of 20,000 patients. And those patients would be starting off as healthy, throughout their healthcare journey. And over time, they would develop those spontaneous diseases that you were talking about previously. And Mars Pet Care, in doing this study, really was remarkable because it was taking multiple business units in the Mars Veterinary Health and Mars Pet Care umbrellas and getting them to get out of their silos and work together. So our colleagues at Banfield, as well as at Blue Pearl, and then certainly at VCA in primary care settings for Banfield and VCA, and for Blue Pearl, it would be for associate pets and those that are part of their blood donor program, since they don't have primary care. And what these patients would do through their owners consenting to this would get a free physical exam. They would get a free blood count and chemistry. We would then also take a number of samples from those patients. The idea there was to build a foundation of a bank of biologic samples, hence a biobank. And by doing that, we then knew that we had a number of studies that could be done on those samples, either immediately after taking those samples or over time through those studies, whether that's genomics, whether that's metabolomics, all these different omics that test different things. And with feces, we look at the microbiome, and it's remarkable over time, as I've learned, the importance of the microbiome is dramatic and works in ways that we never even imagine. As we then see these patients year after year, they're going to develop a variety of different spontaneous diseases. And so what I predict is going to happen is these different types of investigations will bear fruit that speak to different either biomarkers or other signals that can then be correlated with those spontaneous diseases that develop. And so we envision that, during this study as well as after this study, that those biomarkers are going to allow us to develop new therapeutics, new diagnostics. We could see new different foods be developed for these different patients. These biobank types of studies, a number of groups have looked at doing this, and they are not trivial. They are difficult to do, and they're expensive. And I'm so proud of the fact that we've come together within the ecosystem to say, yeah, I think that we can do this. We're probably one of the few places that can pull this off. Talon, additional thoughts that you have related to the biobank?
Just something I think that's great to highlight is that the biobank is very much primary care focused. And as we've developed in clinical research within the veterinary field and in private practice and in VCA, a lot of our opportunities have been very specialty focused. But in the coming years, or the last recent years, we've had more and more opportunities arise for primary care, and this is one of those specific opportunities.
Yeah, it's a very, very exciting project. If there are associates or clients who are listening and they wanted to get more information, is there a website or a location that they can learn more about this?
The URL is marspetcarebiobank.com.
Great. Thank you for sharing that. It looks like we're approaching the end of our time today, and I'm just going to ask in closing, what words of advice do you give someone who wants to get more involved in research?
Sure. I think there's just two comments I would really have around that. And one would be, don't be afraid to actually start out on that journey. Everyone has to start somewhere when it comes to starting any type of new skill set. And while research can be daunting and sometimes intimidating, there are resources out there to really help you break that down and support. And really a message for VCA associates, particularly, Phil and I are really here to help, and we want to help, and we want to be involved. We really love these opportunities. So please reach out to us and we'll make something happen there. And then the other aspect that I would mention to that as well is, one of our, I think it's our logo or our catchphrase. I don't know how we describe that for VCA clinical studies, is that we have passion leads to discovery, is that kind of saying that we have. And I do think that people should really take that to heart. There's a lot of interesting perspectives out there in veterinary medicine, and those voices need to be heard when it comes to clinical research. You don't want just the same people doing research over and over again, because there's a lot out there that needs to be addressed that not everybody is thinking about all the time. So really allow those unique passion opportunities that you have, develop that into a clinical research interest, and let us help you make it happen.
Yeah, I think Talon, as usual, is spot on. I would add that we believe that there are across our network a wide variety of individuals, whether those are technicians, interns, specialty interns, residents, clinicians. I envision a day where our client service representatives could be thinking about clinical studies. And the only way that we know that they exist is if they come to us and say, hey, I have this idea or a hypothesis. So I think the next evolution of what Talon shared with you is, one, come to us with that, but then also come to us with some ideas or hypotheses. And Talon and I will then sit down with those individuals and say, hey, of your top 3 ideas, we think that this one is best based on X, Y, and Z. And it all kind of comes back to that keep it simple that we talked about previously. And we will then help that individual when it comes to the protocol, help them, if it needs to go through IRB review because it's a prospective study, or if it's data related, then we'll help them on that side. And that help goes all the way from the start to then the finish of the study and trying to then get it published. And so I'm super proud of the fact that VCA has put that infrastructure in for private practice for those individuals to potentially be successful in their research endeavors.
Wonderful. Thank you both so much for your time today. And I really appreciated learning more about clinical studies, and am very proud of VCA and proud of the work that you're doing to further science and knowledge within veterinary medicine. So thank you both so much.
Yeah, thank you.
Thank you.
Thank you so much for listening in. If you enjoyed today's episode, please consider subscribing. Don't forget to leave a review to let us know your thoughts, and share the episode with friends. Follow VCA Animal Hospitals on social media at LinkedIn, Twitter, Facebook, and Instagram. For more inspiring stories, visit our website at vcavoice.com.